You had a healthcare town hall today for workers who have either recently been laid off or fear layoffs, like those 400 employees at the Albuquerque General Electric plant. And what did you hope to hear, and what did you learn today?
I think one of the things we're interested in is just the perspective of people who've been taking the brunt of this recession, and how these things become even more acute for them. And one of the things that I think we've got to fix is just the issue of portability in healthcare, because if somebody loses their job or they want to move to another job, we've got to make sure that healthcare moves with them. That's just an artifact of how we developed healthcare in this country that puts us at a disadvantage when we have to compete with other countries. I mean, we're the only place that does it quite that way, and it doesn't work well for the worker, and it's not efficient for the economy overall, and it's not really even an ideological issue. So my hope is that some of those things like that we'll be able to really develop a consensus and be able to fix, so that if people do lose their job, they can keep their health care until they find the next one.
You've been on a listening tour during summer recess and toured all the counties that you represent in the congressional district here. When you're out in the community, are you finding that there are enough resources available, at least at a minimal level, to take care of those that need health care in the community?
You know, what I think I've found is that the resources are there, but they're not allocated very efficiently. And so we're spending a lot of money on healthcare, but we're not getting as much bang for the buck as we need to. There's too much being spent at the end, and not enough at the beginning. We're not doing enough to make sure that people get access to primary care. We spend a lot of money on emergency care, sometimes for things that really should never be in the emergency room in the first place. And I think if we can do a better job distributing those resources, then yeah, we can cover people and make sure that they have the health care that they need.
There were some interesting conversations here at the First Community Healthcare Center on South Broadway about even transportation being a problem in the city. You're a former city councilor.
Yeah.
Can you tie that together in light of people needing to be able to have access to the healthcare at the root level of even getting there?
Yeah. Well, I think it's a good lesson that no government and no agency, nobody can fix everything. We have to work together. It's why partnerships are so important. And when good things happen in New Mexico, it's usually because the private sector, the federal government representatives, the local people all work together. And it's true. If you can have health care, but you can't get access, you can't get to where your doctor is or where your clinic is, it's not doing you a heck of a lot of good. And I think it's why we need to continue to work together across all levels of government and outside of government, with business people and private sector too, to try and leverage our resources, because we are a big geographically distributed state. In states like New Mexico, it's more critical than in other places to have those partnerships and try and leverage what everyone brings to the table.
You talked just now about working together. So one last question on this topic, and then we'll talk about the GE plan just briefly, because I know you got to go on quickly. So why is it so difficult for the opposition to healthcare to see that there's only one right thing to do and provide access to healthcare for people?
Well, I think there are a lot of different ways that you can potentially fix this problem, but to get there, you have to get beyond some of the ideology of both sides and really get to a point where people are cooperating. And we've seen some of that on some issues, and then other issues not so much. And I think that spirit of cooperation is really important to be able to get the best possible plan that we can.
But at some level, I mean, people need to step up and be humane and civil. Yeah. And we do offer children education. Why aren't we offering the workforce health care?
Exactly, and the reality is we are offering health care, but we're not doing it very efficiently, and it's very expensive. If the only place we have true universal health care is in the emergency room. That's the most expensive place to offer health care, much less universal health care. And so I think we can do this smarter, we can do it more efficiently, and we can do it, we can spend our dollars better.
Great. And then just a second story real quick. What have you been able to talk to GE both locally here and nationally, and what is your office doing to maybe see what they could do to negotiate staying and keeping the plant here?
We've been in discussions with GE executives as well as with just people at the plant in trying to facilitate, figuring out if there's if things can be done to keep them here in the community, because we like, those GE jobs are great jobs. We would love to keep them here, and if we can bring something to the table that keeps GE around and keeps those jobs here and keeps those families together that rely on those jobs.
Is your office working with Mayor Martin Chavez and maybe explaining industrial revenue bonds to GE, or what specifically is being done?
What we've done is one of the things we've done is actually work with the union in terms of trying to get the folks who represent the workers there. They get to put an offer forward that says, okay, here's what we would suggest we change to make this more viable for everyone. But they don't really have the institutional support to be able to necessarily put that offer together.
Well, there might be
We've been
capital investments.
trying to connect them with the resources to be able for them to put something meaningful on the table. We've also talked to the executives at GE and said, what do you need? Because we're here to work with you. We want to keep you in our community.
And so what are you hearing from GE? Is it capital investments to revamp and restructure the plan? Or?
At this point, I worry that they are at this point pretty set on trying to leave, and that's unfortunate, and I don't think it needs to be.